into our final conversation. Dr. Njagi is our guest. He's an OBGYN. That thing. He's an obstetrician and gynecologist. What is obstetrician? Anyway, he'll tell us. But karibu sana daktari.
Thank you so much. I'm glad to be here.
It's good to have you here. The reason we have you here is not so you can tell us about OBGYN. We will reveal why you're here shortly. But first, let's give you the day's quote. Felani is just going to give you words that were said by somebody, and let's see your reflection of them.
Karibu sana. They said somebody is Nelson Mandela. And today's quote reads, "What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others." How does that speak to you?
Well, that really speaks to me in the sense that in my everyday encounter is possibly somebody who is in really dire need and desperate, and your kind action could have this significant impact. So what really change are you making? So I think that really speaks to what I do.
It does, 100%.
Lovely.
Obstetrician? Gynecologist. Yeah. I used to pronounce it perfectly until last week. It's like obstetrician now suddenly. With a focus on endometriosis.
Yeah.
And something that we've spoken about a lot on this show. And we'll talk about healing beyond medicine in just a little bit.
Right.
But endometriosis is an area of specialty. Talk to me about the why. What triggered that? Because it also speaks to the quote of the day, right? It's the impact that you're having.
Yeah. So first of all, just to put the definition to this. So when you do obstetric and gynecology, you become obstetrician and gynecologist. So it's basically women reproductive health, basically. So obstetrics, it means the period a woman is pregnant. So it deals with pregnancy. Gynecology then would deal with the reproductive system outside the pregnancy. Just to kind of relate and get into endometriosis. So endometriosis is a gynecological condition. So it's a condition that affects women, there'll be fibroids and so on and so forth. But specifically, endometriosis has been a condition that has not been spoken about. And I'm really glad that we're having this conversation. But let me put numbers. Statistics state that 10% of women in their reproductive age suffer from endometriosis. Let's put the numbers. In Kenya, we know that the women who are in their reproductive age, and this is 16 to 49 years, there will be about 16 million. So if we can translate this to our local numbers, there could be 1.6 million women in Kenya who could possibly be suffering from endometriosis. Yet it's not a conversation that we have. There are so many women still suffer in silence. And so for me, endometriosis is a condition that I very, very dear to my heart. And just getting to understand the suffering these patients undergo. And the gaslighting, the myths around it. I really feel and no one should actually, have to endure this. So I think that it is for me with endometriosis.
I love that you've put it like that, because the gaslighting and then the lack of awareness around it, it's so layered. So that means that when women do seek health and finally they're heard, a certain level of care is required, as always in healthcare, but then maybe even a little extra, which is, I think, where we get into some of the wonderful things that you're doing. Let's just start off by playing a video to contextualize what we mean when we say going above the regular level of care. Let's see Dr. Joe in action.
So hapa utatuimbia wimbo gani?
Tuimbe na wewe nyimbo ya Kristo.
Okay, sawa. Nyimbo za Kristo.
Yeah.
Aya, wimbo gani ya nyimbo za Kristo?
Kristo wa neema yote.
Kristo wa Aya, tuone nani ataimba stanza ya kwanza na chorus na stanza ya pili. Sawa?
Okay.
Aya, sisi ni wasabato, msisahau. Kristo wa neema yote, imbisha moyo wangu, mifulizo ya baraka, inaamsha shangwe kuu, unifunze nikupende, nikuandame kote, moyo wangu ukajae furaha na tumaini. Hajamaliza stanza. Kristo wa neema yote, imbisha moyo wangu. Yes. And we have stepped.
Kuna moja alimaliza stanza, mwingine hakumaliza.
Alisema hapo pengine nyinyi imbeni. Si tulikuwa tunaimba sisi wote.
For someone who's not watching or who hasn't watched that video, what was going
What's
on
happening in that?
Oh, wow. Oh, this was so spontaneous. So it's something that I think I came to realize is the anxiety that comes with being in the operating theater. And I really never appreciated this until a time when I had to be knocked out as well. And it's something we doctors, you know, it's a routine.
You take it for granted.
We take it for granted. Come in and waiting, the machines are beeping, and you come into, you know, the OR just like there are lights here. And there's one common question patient asks, am I going to wake up? Which is a very intimate question. So there's a lot of anxiety. And I mean, I really like to have this emotional connection with my patient because it comes with trust, and it really gives them a sense of relaxing and trusting whatever you're going to do. And so how we started this, it was how do we engage them and have them, kind of disappear and loosen up a little bit. So initially we started them by having them count down. So, hey, let's see how far you can count, 1 to 10. And I always, so you do that and you do ABCD, then you're running, and then say, okay, one day we want to do a song. So I didn't know that this lady, I'm a Seventh-day Adventist, she's a Seventh-day Adventist. And so I said, you're going to sing for us. And it was so spontaneous, but we always have our phones,
Right.
And she said, yeah. And I'm going, what song do you want to sing? She knew I'm a Seventh-day Adventist. I didn't know that. And she said, Kristo wa neema yote. I said, okay, fine, you sing. And she said, we sing together. And there we go. I mean, Kristo wa neema yote. And now, everywhere I go, hi, Kristo wa neema yote. So my name has changed about 3-4 times. Initially, it was Njagi. Then it came, hi, endometriosis. And now Kristo wa neema yote. But one thing that really gives me fulfillment is not even the patient. Yesterday I met a lady who said, that song just speaks to me. When I am, in deep of, my emotions and I think about these words and the song, I'm just powered up. So I'm really glad that, this was not my choice, by the way. I give credit to the patient.
The patient who actually came up with the song.
Yeah.
And you're doing that to ease them into this because you're actually putting them out, right? And it's to distract them from what is happening. So, So as they go, when they come back, do they remember that you did all these things?
Yeah, actually, the first thing they do, if it's counting,
Tulimaliza wimbo.
tulimaliza wimbo, tulifikisha wapi? And you know, more than actually before they even ask, how was my surgery? How did everything go? The first question is, nilifikisha wapi? Which to me is I mean, they want to pick it up. So everything else in between, it's, you know, it kind of not in their memory. So just, you know, how did I do? And
so there's the thing that stays with them is the positive thing.
Absolutely.
That, you know, we're doing a challenge.
Absolutely.
It's a challenge, a scouting challenge, a challenge, a song challenge. And how did I perform in that challenge? Did I do well in the challenge? Is there a difference?
Oh, absolutely, yes.
What's the difference?
And one is, you know, when we are putting the patient under anesthesia, you know, we put monitors, we're checking their blood pressure, their pulse rate. Is, I mean, how calm are they? And we're not really conscious about it initially. But there's, you know, you as a surgeon, there's always the machine beeping. And that really signifies that, you know, either she was, you know, her blood pressures were high, or, you know, her heart was racing. Actually, one of the things is that, you know, it's always very calm. So like they slip into the sleep so gently. And when they wake up, I think that's the memory that they have. And some would, you know, just say, well, I've had surgeries before, but this was different.
It's as simple as the setting and how you went into it. There's something about, and you mentioned it earlier, which is, as a doctor, as an anesthesiologist, it's your work, it's your day-to-day. So sometimes realizing the anxiety on the other end may not, you know, click immediately, but you realized it when you went under. Talk to me about that and how to balance this, because I think there has to be a certain, like, you know, it's your profession, it's that, so there has to be, I think, a certain level of, I don't want to say detachment, but you know what I mean.
You can't be too attached.
I don't know.
Is there such a thing?
Is there such a thing?
Yeah.
Yeah, and I think this is really emphasized. You cannot be attached to your patients, but for me, specifically, is before I'm a doctor, I'm a human being. And I think that's very important. There's the code of ethics, you know, there's a certain way you have to really carry yourself. But just by the fact that I'm a doctor does not, you know, nullify the fact that I'm a human being, a social being, that if you really come and see me today, you see, there's different culture in different spaces. Look at the advocates, the lawyers, you know, they have a certain dress code and, you know, a certain way. So if I'm here and I'm socializing with you, and this is really how I look at it, if we are at a party, the same way we can interact, why does it have to change when you come to my office? Just because I'm on the other side and I'm putting on a white coat. I'm still the same dude that, you know, was, you know. And for me, I really find when there's that environment, you set an environment, there's less tension. One, the patient get to trust you more. You give them space to express themselves. And I always say, you know, when a patient comes to you, there's what they really think you need to know.
Okay.
But for me, there's always the sidelines. And to me, the sidelines are the most important. So you really have to set an environment.
Give me an example of that. What the patient thinks they need to tell you versus what's on the
goodness. So let's say, let me go back to endometriosis. So she knows that my issue is not getting pregnant, for instance. I'm having painful periods. I'm seeing a gynecologist, and heavy bleeding, so on. And then, you know, you just, and basically that's what we really ask, what we call history taking. For me as a gynecologist, that's my specialization. And let's just say, you know, how was your night yesterday? And was all right and had dinner. My menses, and at night I woke up, I was coughing. I thought I had asthma or I had tightness of the chest. Now you might ask yourself, what does that have to do with me being a gynecologist? Yeah. And that to me just lights a bulb. Could we be dealing with the endometriosis of the chest or the diaphragm? And they say, tell me a little bit more about it. Doc, I never thought it was a big deal. But, I usually get this, I've seen a physician who has told me, use an inhaler. No, it can't be that. And right at that point, it just speaks to me. Hey, we might be dealing with an advanced disease. It really makes a huge difference.
Right. I'm actually curious, Doc. The field of medicine in this age right now, we've been given like a behind the scenes, perspective as patients, as just even getting to see doctors in practice, which I think is really good. But I want to understand your thinking behind those moments, like capturing those moments and actually putting them up. What is the bigger purpose here? Because the patient, yes, you have a very good connection with them. You've eased them. There's trust for them to go through this process. What is it doing for the collective?
Actually, the way it started as more of education. So we felt like let's share educational information. For me, it was endometriosis, being in operating theater. What does it really mean if you're coming to theater? Because we never take time to walk you through. Yeah. What is it going to be like for me? How long am I? So the only one question patient asks is, how long is the surgery? Right. How long am I going to be under? And for me, that is the least of my worry. As long as you're going to, you'll be comfortable, we'll be monitoring you. But that, you really get to learn. So we started realizing that we need to put up these facts out there. However, and when I got on social media, there was one expectation that you need to be consistent. So I'm generating content.
And content.
You're a content creator.
Content.
The algo loves consistency.
Right? And this one time, so I'm talking about endometriosis. There's so much you really can talk about endometriosis. And I think I was out of the country and I did not have content, but I needed to post. Yet we had, taken this, them counting down. So I remember like yesterday, I was debating, is this appropriate? Sharing this. So I told my team, please talk to the patient, make sure that we get consent, and we put it. She was a lovely lady, the very first video. So I said, okay, fine. I know it's not going to be, get traction, but I have to post. So I posted this video and she counted 1 to 26. Whoa. Within, I think, 3-4 days, we are hitting about 3-4 million. And I was like, wait a minute. There's what I thought that my viewers want, but there's actually, they're speaking to me. This is really what we want. So it took me time. So I'd post a medical content and then something that is really easy, dancing in the operating theater. And that was actually, gaining more traction. And it was for me, okay, I think this is what my consumers really want.
This is what they want.
This is what they want.
They want the human side.
Yeah. So now it's again now to balance. How do you remain ethically right? And how do you still give what is important and what purpose? Because every video has to have a purpose.
It has to have a purpose, yes.
And I think this is now how we started slowly. It's counting. And really the counting is, hey guys, we can have fun in the operating theater. Hey guys, we can dance in the operating theater. Now, it goes two sides. Somebody can feel that this guy who's dancing in theater,
he's not serious.
He's not serious. He's a joke. Who'll be there? Who'll be there dancing in the operating theater? But if you actually look at this different video, you'll actually see me dancing.
Right.
And there are some that you see me operating. And I'm a two totally different people altogether.
Let me ask you. When you're dancing, are you taking a pause from the procedure to dance? It's like, is this your break time?
You're like, guys,
Let me do some quick TikTok choreo.
Yeah.
TikTok time.
Give a guy a knife. At what point are you dancing?
Usually,
I'm concerned.
most of the time. No, I feel you. But for me now as a doctor, if I had to be operated, I would really want to be operated by that dancing doctor. Of course, they know their stuff. And there's a reason to it. It also does so much to you. Like, you're relaxed. Surgery is a very high, adrenaline fueled, process altogether. Because you have a life under the knife.
Yep.
And this patient has to go back home.
And
so the
and
dancing
on a
is
clock.
on a clock.
They'll be waking up soon.
Yes, ideally that's important. And I know when I was younger in the field, there's one thing that we used to see. Let's see who can do a cesarean section, the shortest amount of time. Now that over time that really changes. It's getting the best outcome possible. So the first stage patient has to go home. The second thing is they're here because they have a condition that you have to take them to as near normal as possible. So you're going to balance how much time they're going to be under anesthesia and what do you really need and to do for you to perform a good surgery. Now, it might take everything you've mentioned. It might take taking a break. And, so people might say, what does it mean taking a break? Do you want a surgeon to operate on you 4 hours straight? I'm a human being. I get tired. I need a mental break. So in most cases, what you do, you pause. The patient is under anesthesia, as you right. They're not bleeding. And you can take a short break. And just that detachment, you come back again. It's something that I heard somebody saying, view on the balcony. So like you're coming out, and I do this a lot. So let's say I'm stuck in a very delicate space, very complex, like endometriosis, and my mind has been, stuck there for hours. Sometimes I say, you know what? No, take a break, 3, 4, 5 minutes, come back. And when you come back, different perspective.
Clarity.
Right.
Get this clarity.
We'll watch another video, but let me also sample some of the comments. Bibi Uswini says, hongera daktari. Hapo nimepoa tayari. Huku kwetu hiyo endometriosis haina jina la Kiswahili, lakini inapewa maana nyingi tu. Kama ipi Bibi Uswini? Tuambie. Nelson Mandela, from Nelson Mandela's words, what one policy change would you recommend today to ensure women suffering from endometriosis receive timely diagnosis, affordable treatment, and the dignity they deserve? You respond to that, Daktari, after we watch the video. Before we watch the video, we'll tell you about Kenya Power and star 977 hash.
Hapa tunaweka plagi. Star 977 hash. Postpaid or prepaid?
Are you a postpaid or prepaid?
Uko prepaid ama ile ya token? Ndio hiyo inaitwa prepaid.
Honestly, I am a postpaid.
Postpaid.
Yeah.
Finally. I get so happy every time.
Postpaid person.
Every time.
Clock it.
Yes, Crockett. So, as a postpaid person, one of the things I struggle with is sometimes I'm like, hiya, did someone come to read this meter? Or is this bill an estimate working from other times? And I did not know that, yes, sometimes they do estimates.
Yeah.
But for postpaid customers, you can read the meter yourself and send it by dialing star 977 hash so that you don't have to be like, I switched off everything. I traveled for 2 weeks. How is the bill the same as last month, right? So get your meter reading. You can give it to Kenya Power yourself by dialing star 977 hash. It's great to also check, your latest bill, your previous bills for paying bills, everything under the sun as far as Kenya Power is concerned. I don't know if there's any other post-pay issue that you struggle with.
Not really. I think I try to make my life as easy as possible.
Well, star 977 hash will make your life simpler.
Yeah.
Everything else that was remaining.
Yes.
Star 977 hash sorts it out.
Right there.
Yeah, Philip, let's play the second video, and then the Dr. will tell us what this is about.
Relax. Take it easy. I cannot believe you're the one who was giving me maneno hapa. Maneno imepotea sasa. Maybe I'll see you after a couple of weeks. But of course I'll see you. I'll let you know what you found. Where's Odi? Oh, duty. They don't need sicko. They need Odi. Off duty. No, whatever you need. Line little.
So I guess this is post-operation.
This is right before anesthesia.
Right before.
Yes.
Talking about all these things, just making them calm down.
Yeah, so this particular one, first of all, I have a lot of respect for men and women in uniform. So you can hear the code, OD. So, of course, she's one of our women in uniform. So what was very interesting, I've always been fascinated, is when you see, let's say, a police officer, that style of authority. And it's so. And I think right before surgery, we were jazzing. And she was, like we were having a vibe.
Yeah.
And I remember this particular time, the anesthetist said, you guys need to cut off your stories and we need to get started. So we come in. And here you can hear me saying, I cannot believe that it was you that we were just conversing outside.
Stories zilikuwa mob hapo nje.
Stories imeisha. Zimeenda wapi. And that really now speaks to you. Just being in this space completely changes everything. So, we were just there. And again, she doesn't know this particular point. We've started inducing. So my anesthetist is giving anesthesia. But she kept talking because she doesn't want to get to that point that now it's time to sleep. So she's
delayed the process.
Delaying the process. Little does she know, the process has already started. She goes to sleep and, when she wakes up, she'll be like, what happened? I thought we were having a conversation. And I always joke with them and I say, okay, what conversation were we having? Can we finish our conversation now? That would be a day after.
Like I said at the beginning, it's little acts of care that go a bit above and beyond, or may not be prescribed. They're not written in any book. Like you said, ni wewe tu, and some of these things are spontaneous. But I want to know what other things we may be missing out, just because sometimes healthcare can be, like you said, it's intense being in an operating room, but even outside that, we deal with doctors that have massive burdens as far as like their workload. They're dealing with so much. Maybe a healthcare system that's not facilitative. So what are the other acts of care that you think slip through that we need to bring back and to highlight?
Well, one thing I'd say that, I'm not sure this is what actually you wanted to speak out. There's a lot of mental health in healthcare spaces. And it's everything you've mentioned. You don't have appropriate equipment, the working hours, the demand. We still have a challenge in terms of staffing and numbers, so the workload is quite massive. And this is whereby you have to be intentional. I was having a conversation not long ago with Dr. Manu Shandaria, and I asked him, what can you tell the young people just as a part of encouraging them? And I was not expecting the answer. He said, you gotta help yourself. Like, wait a minute, he's 98. What do you mean? Like he did not think about it.
Yeah.
He just like it was like right on his lips. You gotta help out. You gotta help yourself. And I look at it and relate it with my day to day. It's exactly what you mean. I have a family. I have a high volume of demand. I, work in a very high intense environment. Sometimes outcomes might not be what I want. Yesterday I had to hold family conference, and that is so, so demanding. So you really have
What's family conference?
Family conference is whereby, so right now I'm in Nairobi. I am a student and gyne-oncology fellow. So this is a sub-specialization. Like endometriosis is not enough, but it's a sub-specialization on cancers.
Wow.
And being a malignant and a terminal condition, sometimes you need to get family and update them. This is where we are, and this is really what's going on. And I remember yesterday, one of the patients came and asked me, why is my patient not getting appropriate care? So you really have to explain. So at that particular point, you really realize that, hey, dude, you're only you. And no one will come and ask you, hey, Joe, are you okay? Is everything fine? Because nobody come and ask the doctors, are you okay? Is everything fine? How are you holding up? So really, you got to look after yourself. So you got to be intentional about it. You got to take a break and say, you know what? This time, I'm going to do me.
Yeah.
And what happens in situations where, so you're a doctor on call, you have your regular patients, and so you're part of a camp that happened in Kirinyaga County, Healing Mama African. Maybe you can tell us a little bit more about that. The number of surgeries conducted in a week. So you're doing high volumes of surgeries. So you're from this to this to this. So of course, in such situations, you're not able to operate like as you would in a normal hospital, take a break. How do you manage such situations? Because the work calls for it. Or you could start by telling us about the medical camp and then tell us how you deal with such high pressure situations.
Yeah. So the Healing Mama Africa was initiative that over time I've gotten to create these amazing networks, both local professionals and international professionals. And I realized that there's a gap, and the gap is access to care. So when we started a few years ago, endometriosis and let's say laparoscopy, which is a minimally invasive surgery, in most cases was available in private high-end hospitals. So access was quite low. So Healing Mama Africa, we just thought together and say, what if we take this high-skilled level of surgeries out of big cities and take it to the rural? It's a very controversial phenomenon altogether. But I really support the fact that the poor patient, in my opinion, they would require these advanced technology surgery. I can support that. Because they're not going to afford painkillers. They cannot afford time off from work because they are working on daily wages, risk of complication, lack of blood, and so on. So that's the phenomenon that we employed. So we said, okay, from US, from Germany, whatever. So you guys, and actually most of them, all of them were my friends. I said, we got to do something. Can you come to Kenya and we go to Mashinani and do the surgery? And I think one of the concern was, how are you going to do this in the rural? And this is what we do every time. You just need to have a good setup, good plan, and a good heart. That's it. So the part of the heart had to be part of the process. And to our surprise, we had a patient who traveled from Nigeria.
Wow.
Yes. We had a patient who came from Cameroon. And that was deep. It's just a reflection of how much need for access, not only in Kenya, but across Africa. But now going to your other part of your question, you have to align your purpose. What is my purpose? And for me, as a Christian, is I need to align my purpose with God's purpose. Is this what, if I wake up every day and I knock at his door and I say, okay, God, what did you want me to do today? And I go do it. And all what I do, will they say, okay, fine, that's what I really wanted you to do. So you step far beyond. Some of us say it's a calling, it's, a career. You see far beyond. And I think this is what we started. What difference are you making?
Right.
The moment my curtains come down, how will I be remembered? And I think that's what keeps speaking to me every day.
How many surgeries were you guys able to do, just out of curiosity?
We did 25 surgeries in 1 week.
In 1 week?
Yes.
All laparoscopic.
All laparoscopic.
Wow. So is it faster? First of all, let's just take a couple of steps back.
Yeah.
What is laparoscopic surgery?
Laparoscopic surgeries. So the conventional surgery, let's say, Eric, you have, let's say, hypothetically, you have an appendix.
Yeah.
Appendicitis, or you have an appendix, you have appendicitis.
So hypothetical, I have it.
Yes, yeah. Yeah, hypothetically. If you had it by now, And you go to the general surgeon, and she say, okay, fine, I think you have appendicitis, we need to remove the appendix.
Okay.
So you give you the two options. You can make an incision or cut you open. Of course, they have a pretty small, small cut. They do. But in most cases, there's an incision.
On my belly.
On your belly.
Right.
All right. Open, because we need to access inside your abdomen.
Right.
And then operate. I have my fingers, my hands inside the abdomen. Okay. Yeah, I mean, how am I going
Pull
to get
the appendix out, cut it.
Yeah, cut it, clip it, and get it. And then you're happily ever after that.
Yeah.
So you can do it that way. So one thing is to see and to access
Yeah.
the disease.
Yeah.
You can do it in a different way. You can introduce a camera, which is going to give you vision, or you can be able to see. And then you introduce small instruments that now you can be able to access and perform the procedure. So the difference is, open surgery, you have a big incision. Laparoscopy, you have small incision. That's why I call minimally invasive surgery.
Okay.
So what are the advantages? Less pain, less bleeding, less risk of infection, less risk of complication, less risk of
Forgetting gauzes in
forgetting.
my tummy.
You had to mention that, huh? Less risk of complications.
Yeah.
And the outcome, for me, you cannot compare the two. You can't really compare the two. The outcomes are amazing. I operate you today, tomorrow you're going home.
Wow.
Less need of painkillers. But then the question would be, what really makes the difference? It's just a skill that you get to learn
Right.
and to train. Of course, the equipment.
From a cost perspective as well.
If you ask me, which would be different, laparoscopy should be cheaper than open surgery. I give an example why. And if you don't consider the initial investment on the equipment, because the initial equipment, they're expensive.
Very expensive.
But the surgery itself, you're going to need less suturing material, less
Less consumables, basically.
less consumables. Yeah. So it should ideally be less expensive.
Over time, it becomes cheaper. Because, even as you're investing in the equipment, you're not recouping the price of the
cost.
equipment with the
Yeah.
first
The first surgery.
that you do, right?
Yeah.
So over time. And if it's publicly funded, then you're basically saying that we are reducing the cost of the requirement for all these consumables on a regular basis. You have the one equipment and you've got a trained surgeon who is doing this, then it becomes cheaper. What would be the hindrance for actually making it more accessible?
I think it's a training.
Okay.
It's just a skill.
How long does it take?
It depends
On
on how blessed,
So let's say this.
you
How
are.
blessed?
How blessed.
Financially, mentally.
As a doctor,
Skill-wise.
at what point
Yeah.
do you get this training for this kind of surgery? Because when you're doing your undergrad degree, you're actually also training as a surgeon. Is it taught there, or is it specialized training for laparoscopy?
It should be. Now, the medical council, the Kenyan council, states that it's not a specialization. It's an added skill.
Okay.
So what that therefore means is, let's say once I finish my undergraduate training, I need to specialize as a gynecologist. It should be incorporated in my training.
I see.
Ideally. However, in other setting, you can have it as a specialization. So you become a minimally invasive surgeon. But it's just a different way of doing things.
Okay.
So you can do it open surgery. So whether I'm removing the appendix open surgery or laparoscopically, the principle still remains the same. It's my approach that is different. So there are those, like myself, I took interest and I felt that I needed to invest independently on minimally invasive surgery. So now you can have additional training and, just really commit yourself to it. You're really getting out of your comfort because when you start, one of the question would be, in any skill, there's a learning curve. And with the learning curve, you find also time. If I'm going, let's say, commonest surgery is a hysterectomy, removal of a uterus. So if I do open surgery, let's say it takes me 1 hour. My first laparoscopic surgery of the same manner took me 3 hours. You really have to ask yourself, is it, why do I have to take, more time? And everything, safety and whatever comes into. But cumulatively, you find it's better outcome. And with time, your skill gets better.
Right.
So you ask me today, my laparoscopy removal of the uterus is much faster and safer and better outcome than open surgery. As a matter of fact, rarely do I do open surgery. So you have to allow yourself to get into this learning curve. The challenge is if I've got, who wants to get out of their
Comfort zone. Yeah. There's a question from Nelson Mandela, 4550, asking, from Nelson Mandela's words, what's that one policy change that you would recommend to ensure women suffering from endo receive timely diagnosis, affordable treatment, and the dignity that they deserve?
I think first of all is just to have a policy. There's no policy. I think just to really answer that question, so you look it up, there are really no policies on endometriosis. Literally does not exist.
Yeah. Is there like a best case scenario, a best practice from somewhere else globally where they do have endo policies, or
Yes.
would we be the first?
There are policies in different settings. There are few European countries that we borrow their policies. But what is really sad, so there are policies, and policies just stipulate this is how we manage, the condition, this is how we fund it, and so on. But now if I come close to us, the experts, they are the protocols. So protocols basically guide you. Patient is going to present with this, and then this is what you need to look out for, and that really helps in the management.
Right.
If you don't have that protocol to guide you, when we had COVID, we had protocols set in place. How are we going to screen, and once we, test and treatment and so on, and what there is, which still goes back. Why do we still not have these policies, protocols in place? And maybe it's conversations like this
Yeah.
that is going to help in creating awareness. And a few years ago, you'd rarely hear endometriosis.
Yeah.
True.
I think the very first time we heard about endometriosis was with, the late
Njagi.
Njagi. But can you imagine how much she had to suffer? And she had to travel outside the country. And I remember right before she died, she had made this letter to His Excellency. I think he was in a trip to United States, and he was saying, please, during your trip to United States, go to, Atlanta, Georgia, and see the Center for Endometriosis. It was a call for the 1.6 million women who suffer from endometriosis. So what I can say, we have to be intentional about it.
Yeah.
For me, more than what the government can do for us is, for me, what can I do for endometriosis? So it's possibly healing Mama Africa. It's being here and creating awareness and education, being on TikTok. But from a professional point of view, I think this is a conversation now we're having. I'm glad for once we are having training and lectures on endometriosis in medical school, where a few years ago, I don't remember having a single lecture on endometriosis.
Wow.
So there's hope.
Okay.
And really, not really to throw the system under the bus, but it was the challenges that goes with diagnosis of endometriosis. Because you needed to have diagnosis performed by use of laparoscopy, but laparoscopy was not accessible. So how can you treat something that you cannot diagnose?
Yeah.
And then the skill that comes to it. Surgeries for endometriosis are quite complex. That's why Njagi had to go to out of the country. So we have to be intentional in terms of training, creating awareness, and advocating.
All right. Thank you so much, Doc. We have to wrap it up there, but I'll say a massive thank you. One, for the work you're doing in your capacity as, MD, obstetrician, gynecologist, and also just in your capacity as a human being. It's wonderful. And thank you for coming on. We'll have you back and continue having these conversations on endometriosis.
Thank you.
And if they want to find you, because I'm seeing there's a question that came on our comments on someone who wants to recommend someone that has endo, how can they reach you?
So I run a facility in Kerogoya. So my practice is in Kerogoya. The facility is called African Center for Endometriosis. So either on our social media or contact, they can contact the facility. The only thing is we have a little bit of a backlog, so we need to be a little bit patient.
Okay.
All right. Thank you so much.
Thank you.
Let me share what's coming up next. We have to wrap up the show, but Winnie Lubembe will be with you for Good Vibes. It's a Friday. What's making you smile these days? She'll be talking to Tablaze, who is a recording artist as well as an architect. So let's get into that Friday mood on 96.3 Nation FM. Pia kutakuwa na Claudia Naisabwa na Brian Aseli on Vibe Shift.
Mambo ni kama hayo.
Yes.
Yes, so for our viewers who are not able to catch us on ADN at present, our engineers are working on that, but you can catch our signal. NTV is still also available on Signet, and you can also follow us online and NTV Kenya on YouTube. We are live streaming the shows and all our shows there throughout the day. So asante sana for tuning in to Fixing the Nation today and this week. Have a lovely weekend. See you on Monday. Enjoy yourself.
Enjoy.